Hi, my name is Joyce McNally, and I'm one of the care coordinators at Friends Life Care. Today, I'd like to talk with you about palliative and hospice care. Comfort is a high priority for both of these. Let's look at what types of care are involved. Palliative care can be used anytime. It's probably a good idea to talk with your doctor in advance of having a diagnosis, so that your doctor knows to offer you a range of treatment modalities. In choosing palliative care, you decide to use a treatment that is less difficult, maybe not as aggressive or invasive, to resolve your health issue. You're still getting treatment, but you're not doing it in a way that's uncomfortable. Let's look at an example of how palliative care is used. I'm going to introduce you to my dog, Ozzy. Ozzy is a long-hair miniature dachshund, and as you can see, he's got a very long back. Quite a while ago, when he was 6 years old, my husband was walking him, and he was dragging his left rear foot. With this breed, that can become an issue because they have back problems with the long spinal column. We took him to the vet, and we're offered 3 different ways of treating him. The first one was surgery, where they go in and they release the impingement of whatever the spinal cord is caught on. The second option we were offered was giving him muscle relaxants and pain relief and confining him to his kennel for possibly 4 to 6 weeks. The last option we were given was euthanasia. So for a 6-year-old active dog, confining seemed rather drastic. We chose surgery. We chose surgery again at 7, but at 11, when he had a similar problem and we were offered the same possibilities, Joe and I decided that this time around we would use muscle relaxers, pain medication, and confinement. With an older dog, it was a more acceptable situation for the dog and for us. Thanks, guys. So I'm going to show you a picture of Oz in his kennel. And I think if we get the glare correct, you can get a better idea that he was in an open metal cage. He could interact with us, and it was more acceptable for him. Palliative care still is a medical treatment. It's just taking the treatment to a level where comfort is high on the priority list, and that you're treating symptoms, relieving problems that are causing discomfort. Now let's talk about hospice. Prior to my joining Friends Life Care, I was a primary care hospice nurse. Hospice is used when your doctor thinks you have 6 months or less to live. There's a list of Medicare-approved diagnoses. Either Medicare or your health insurer will pay for this care. It includes services from a multidisciplinary team that your doctor can still direct. He has help with visits from the hospice nurse, social worker, chaplain, and home health aide. They come and do their tasks, and then they leave. Hospice services can be provided in your home or at a facility. Here's an example. I'm going to tell you about a very memorable patient for me. Let's call him Steve. Steve was 24, and he had just finished running a 5K race in Philadelphia. Steve participated in a lot of races, but this time his leg hurt in a way that he couldn't understand, so he went to his primary care doctor. His doctor thought it was a muscle problem, so he gave him some muscle relaxers and said to get back in touch with him if he didn't feel well in a couple weeks. Well, Steve didn't feel well, and when he went back and went through more testing, it was found that Steve had bone cancer that had already metastasized to other locations. A very sad situation. His family was quite supportive and built a ramp on their house. On a day when Steve was feeling better, his friends would come by, help get him in a wheelchair, and they'd go out for lunch and a movie. I think he also saw some Phillies games. Things progressed, and long about Christmas time, Steve was doing very poorly. That Christmas, I happened to be on call. And on Christmas Eve, long about 10 o'clock, I received the call that Steve was dying. A friend of mine, a colleague from hospice, lived closer to him than I did, and she got over there and started with medications and comforting him in advance of my getting there. The family was around the bed. We kept Steve as comfortable as we could, and he passed around 2 o'clock on Christmas Day. A very sad situation. In summary, both palliative and hospice care encompass less aggressive medical treatment aimed at keeping the patient comfortable. Palliative can be used anytime in your lifetime. What you're expressing is you're going to treat the medical issue, but you want to do it in a way that's comfortable to you. Whereas hospice is doing a similar treatment in keeping you comfortable, but it's an educated guess by your doctor that you have 6 months or less to live. So really, you're using comfort care in both situations, and palliative is just over the course of your life versus end-of-life care. Thank you for watching this seminar.